Residents have a certain expectation when it comes to their drinking water, and it's that it will be safe to consume and that governmental regulatory agencies will alert them when there are water quality issues. Local municipalities like the town of Hempstead rely on agencies such as the EPA or the State Department of Health to alert them and set standards as contaminants emerge. Here at the Town of Hempstead Water Department, staff are tasked with constantly monitoring and testing water that is pumped out of 32 wells at 17 sites that service a portion of the residents across the town. The Hempstead water districts currently meet or exceed all federal and state drinking water standards. However, like many water districts across Long Island, several Town of Hempstead water supply wells have now tested positive for varying amounts of 1,4-dioxane. We need the federal government regulators to act and set formal standards for 1,4-dioxane and other emerging contaminants so that our town can confidently move forward with the implementation of new water treatment systems to further treat our drinking water if that is what is required. However, the town of Hempstead is not sitting idle, waiting for the EPA to act. As part of our recent multi-year capital plan, we have included the necessary funding to plan and design treatment systems for the removal of 1,4-dioxane. The town has also submitted grant applications to New York State for the construction of several treatment systems. All this is being done assuming and hopeful that future treatment standards will be set by the EPA.
The issue that we're here to discuss today requires nothing short of a strong federal, local, and grassroots response. As we've all seen by now, a recent study by NYPIRG recently found that Long Island's drinking water supply is the most contaminated in New York State, and places like Hempstead have been especially hard hit. This is a serious public health crisis, and we need the EPA, the Environmental Protection Agency, to act with the urgency that this situation requires.
Again, if we are the most contaminated water system in the state, and we are a sole source aquifer, I mean, Long Island gets all its water from the ground we're standing on. This is different from New York City and other parts of the state. So the contamination is extensive, it's real. We have to find out again exactly what the danger levels is on these new contaminants, but it has to be done quickly. And then we have to get full cooperation with the federal government, the state government, local governments, all of us working together.
NYPIRG did an incredible job and an important job with its research into Long Island's groundwater, drinking water supply, as NYPIRG did for the rest of the state as well. And it really highlights the urgency for the EPA to act in setting maximum contaminant levels and to also dedicate funding that it has towards helping us solve this issue.
If our drinking water that comes into your house is safe in that they are standards that have to be met. The concern is that there are new contaminants that have not been identified yet as something that has to be treated. And what we're doing together as a delegation under the leadership of Kathleen is saying to the EPA is please identify this clearly as a contaminant that we need to go after and help us figure out where to come up with the money to pay for it.
I do want to reassure our residents that the water is safe to drink. Thanks to the hard work and efforts of our water suppliers, and we have many different kinds of water suppliers, thanks to their hard work and their efforts, they are keeping the water safe for us to drink. Nassau County regularly tests water at all the wells to make sure that they're safe to drink. However, this really incredible report from NYPIRG about the emerging contaminants tells us that we have to stay on top of it and we have to face it head on.
It's not that Long Island has the most contaminated water, as been reported, but rather that Long Island has groundwater that is the most tested. That is a big difference, and it is a positive, not a negative.
The public has the basic right and expectation when they turn on the tap that the water is going to be safe for them to drink. But unfortunately, because of an industrial legacy that exists here in New York and elsewhere in the country, that basic right has been put in jeopardy. The public also has the basic right to know what is in their water. which is why NYPIRG analyzed EPA data regarding emerging contaminants. These are chemicals that EPA believes could have negative health consequences and may be in drinking water supplies. And we found that the drinking water supplies serving 16 million New Yorkers to have detected one or more emerging contaminants.
Long Island is in a drinking water crisis for our quality. On Long Island, we do have a sole source aquifer. That means 3 million people live on top of our drinking water. So it's not that it's not that we are testing more, it's actually that we are finding more. So for instance, with 1,4-dioxane, we here on Long Island had the highest levels of 1,4-dioxane found in anywhere in the nation.
So we're here not only asking for the EPA to set a standard, but asking to have a seat at the table so local government can work hand in hand with our colleagues and with regulators to expedite the review and approval process involved in further treating our drinking water.